Guillain-Barré syndrome present? Well, it presents with a symmetrical ascending weakness, which starts from the feet and moves up the body. There will be reduced reflexes, because it's a peripheral neuropathy. There may be peripheral loss of sensation or neuropathic pain, and it may progress to the cranial nerves and cause a facial nerve weakness as well. So what's the clinical course? Well, symptoms usually start within 4 weeks of the preceding infection. So they may, in your exams, have had a gastroenteritis 4 weeks previously. The symptoms typically start in the feet and progress upwards, and the symptoms peak within 2 to 4 weeks, and then there's a slow recovery period that can last months to years. How do you make a diagnosis? Well, a diagnosis of Guillain-Barré syndrome is made clinically. There's no specific test that confirms the definitive diagnosis. There's some criteria called the Brighton criteria that can be used for a diagnosis, and it can be supported by investigations such as nerve conduction studies, which show reduced signal throughout the nerves, and lumbar puncture to test for the CSF. And in your exams, the CSF of somebody with Guillain-Barré may have raised protein with a normal cell count and normal glucose. Let's talk about the management of Guillain-Barré. It involves IV immunoglobulins, plasma exchange to try and remove some of those antibodies, supportive care to make sure the patient is still well despite having the associated weakness, and importantly, they need venous thromboembolism prophylaxis. So maybe low molecular weight heparin or enoxaparin to prevent them from developing blood clots, because pulmonary embolism is a leading cause of death in Guillain-Barré syndrome. In very severe cases where there's respiratory failure, then the patients may need intubation, ventilation, and admission to the intensive care unit. Finally, let's go through the prognosis. These are rough numbers, but around 80% of people will fully recover. 15% will be left with some sort of neurological disability, maybe some slight weakness or some neuropathic pain, and 5% of patients will actually die from the condition. Thank you for